Hi, and welcome to Dr. Brainwaves. I'm Dr. Rena Azar, and this is Dr. Susan Raschal, who is going to talk to us today about one type of urticaria. We're going to break down the talks about hives into a series because there are so many of them. And it's pretty extensive amount of information that's related to a topic that affects 20% of people. So she is going to talk today about dermatographism, which is not writing on your skin with a pen, but it is writing on your skin potentially with maybe your fingernail or a pin. I think everybody's seen somebody that has that phenomenon of being able to have pressure with a sharp pin and you write on the skin and it leaves a welt behind in the exact design that you've drawn. That is dermatographism.
So as Dr. Azar clearly stated, dermatographism is literally writing on your skin with a sharp implement or, like she said, your finger or anything else. Also, if you're leaning against something, you will see a mark, a welt that it will appear. Dermatographism literally means, if you break down the word dermata, that refers to your skin, and graphism refers to write. So it literally means to write on your skin. But the interesting thing about it is that you can leave a message on your skin, because if you write something on your skin, it will actually leave those marks. The point about most urticarias, which make it so difficult to identify, is we don't know the cause. Just some people have it. Like I mentioned, 2 to 5% of people will have this dermatographism. What we do know, it has to do with mast cells. And mast cells are specialized cells that are in your skin and respiratory tract, GI tract, and other parts of the body. And in the bloodstream, there are basophils. And the thing that's important about that is, and some people are savvy about these things, that those cells will release histamine from mast cells. And those mast cells, when they degranulate or open up, they release several mediators, but one of those mediators is histamine. And the reason why I want to go into a little detail about that is because we use antihistamines to try and block the histamine receptor and help prevent you from having hives, or more importantly, the itching. Because again, it's very difficult to get rid of hives, or it can be, so we try to focus on the most disabling component of hives, which is the itching. So medications like antihistamines, like I mentioned, as well as medicines that will block histamine 2 receptors are used, which are medicines that frequently are antacids like Zantac or Pepcid, those types of medicines. And then there is another medicine that we can certainly use called Singulair. And Singulair or Montelukast is a group of leukotriene receptor blockers, which can also help control the itching from this condition. Most people do not treat dermatographia because it's fleeting. It doesn't last very long. In a few hours, it's usually gone. And one of the things that I had mentioned to you previously is that hives usually is migratory. It moves around. Well, the dermatographia is going to occur wherever you are writing or wherever you're leaning against or wherever there is pressure applied to your skin. Some of the other ways that we will treat that is try not to let things get on your skin loose. You want to wear clothing that's very loose fitting. You don't want it to be really snug because you're going to get a mark there. And when you get that swelling in that area or that wheal or that area that is heightened, it's going to cause you to itch. And when you scratch it, it's going to make it that much worse. So that's what we're trying to prevent. So those are some of the things to know. It is not a life-threatening condition by any means, but it can be extremely annoying. So that is dermatographia. It can be treated. And the key thing is just to recognize that it's not life-threatening. You don't have to run to the emergency room, or you can bring it to your doctor's attention, but there isn't a whole lot that can be done with it. So we just try and treat the symptoms. Thank you. Stay tuned. The next topic I'm going to talk about is kind of crazy if you've never heard of it or experienced it: cold-induced urticaria or cold-induced hives.